Good evening, everyone. I'm Congresswoman Bonnie Watson-Coleman, and I am indeed honored to speak at your conference today. Since my first days in Congress, I have fought to close the racial mental health gap and pursue equity in all aspects of healthcare. Americans' collective mental health is at a low point. After all, we're in the third year of a pandemic that has brought about widespread isolation, uncertainty, and suffering. There's no question that Americans are hurting, and it's long past time Congress took action to address that pain. As a grandmother, youth mental health is a particular important issue for me. Mental health struggles often begin at a young age, and youth mental health was on a rapid decline in the decade leading up to the pandemic. The Surgeon General's office reports that between 2009 and 2019, the share of high school students reporting persistent sadness or hopelessness increased by 40%, while the share of those contemplating suicide increased by 36%. The youth mental health crisis also disproportionately affects Black and brown youth. And the first step toward addressing this crisis is getting these underserved communities the resources they so desperately need. Whether as policymakers, care providers, or advocates, we must all prioritize eliminating disparities in access to and quality of treatment. Mental health care is essential, and in many cases, even life-saving. We live in the richest country on the planet, and every American should be able to receive the care they need when they need it. But as we know, this is far from the reality that we live in today. As a member of Congress, it is my mission, my civic duty, to change that reality. That's why in 2019, I launched the Congressional Black Caucus Emergency Task Force on Black youth suicide and mental health. Our report found alarming increases in suicide rates among Black youth, largely due to systemic inequities in access to mental health care. In youth ages 10 to 19, suicide is the second leading cause of death, and Black children under 13 are twice as likely to die by suicide than their white peers, and the Black suicide rate is still on the rise. I refuse to let my grandchildren grow up in a world where mental health struggles among Black children and adolescents go unaddressed. In response to the task force findings, I introduced the Pursuing Equity in Mental Health Act. My bill would directly address structural inequities in mental health care by investing in inclusive mental health services, increasing funding for minority fellowships, and directing resources to federal departments and agencies. On top of this, I established the Black Mental Health Brain Trust earlier this year to further fight racial disparities in access to care. By forming a unified front of researchers, practitioners, and advocates, the Brain Trust is working to create a mental health system that works for all. Of course, policymaking isn't the be-all, end-all solution to the racial care gap, and I'm so grateful to be fighting alongside organizations like the New Jersey Association of Black Psychologists. On top of your tireless advocacy for structural change in our mental health care system, your organization has done the work of recruiting and training a Black mental health workforce. Investing in culturally competent care is one of the most important things we can do toward advancing equity in mental health, and I want to thank you for your efforts toward doing so here in New Jersey. By putting equity first, we can close the racial care gap and get one step closer to putting an end to our country's mental health crisis. Thank you, and God bless.